It's 8 minutes past 10. Now, you will have seen, of course, in the papers, maybe even heard on the radio, of course, and possibly seen on the TV if you've been watching the Olympics, that a number of Olympians have been spotted covered in large red dots as a result of something called cupping. Now, it's said to be an ancient form of Chinese medicine that promotes blood flow. But is there actually any proof that the treatment works? There's been a lot of talk about this in the last few days, and we thought, well, do you know what? Let's go and find out. So this morning, I went and had a cupping session, and we put a picture up on Twitter as well. You can find it on my Twitter page at @Lampon, where you can actually see a picture of me lying flat. There you go, with my top off. There's a sight people would pay for, I'm sure. And actually having these cups suctioned onto my back. You can go and look at that now just to see what it was all about. We went and did that this morning before the show, and then literally hot-footed it over from the clinic straight to here. I mean, I arrived in the studio with about 5 minutes to spare. How do I feel? What do I make of it? You're going to find out very shortly indeed. And if you've ever had it, or ever had it done to you, suggested you went and had it, what did it feel like? How did you get on with it? 0116 251 1049. 0116 251 1049. You can also text in as well on 81333 and start your text message with the word Leicester. More on cupping coming up in the programme in just a moment's time. A horse with no name. And that is America here on BBC Radio Leicester. It's 14 minutes past 10. And I sit here feeling slightly dozy, a little bit like I could do with a little bit of a sleep, but I feel fine, actually. And if you're wondering, well, why wouldn't you feel fine, Lampon? It's because we've been talking about cupping this morning. In fact, there's been plenty of stories in the news on this. This is cupping, a Chinese therapy that uses cups to produce suction, which is pulling the skin away from the body. It's said to promote blood flow and supposedly is meant to ease aches and pains. Some experts say there's no scientific proof that it works, but for some people, they claim that it has. Now, it's caught our eye this week because of a couple of Olympians who have decided to have cupping. Michael Phelps, of course, the swimmer, the American swimmer, who actually won gold. So I don't know whether it worked for him on that, but certainly that's not done him any harm. Various other athletes as well have been doing it. You may, of course, have heard of it as well with some celebrities in the States that have done it. Gwyneth Paltrow is a particular fan of it. Jennifer Aniston is another fan. There have been many actors that have tried the cupping experience. So we wanted to know what it was like, what all the fuss was about, and how easy it was to do. So this morning at 8 o'clock, I was at a clinic in Leicester to have cupping. That was where I met Dr Rizwhan Suleman. And this is how part one went. And it gives you an idea. There's also some pictures as well that we put up onto Facebook and also Twitter. But here's part one of my cupping experience.
Come on and take a seat. Okay, so we're going to go through a few questions now just to make sure that this treatment is suitable for you.
Okay.
So cupping therapy and Hijama and even the other therapies that we offer, and everything is kind of suitable for different people. So we'll just go through a few of these things first. So you've never had any viruses or anything in the blood before?
No.
No. Have you never ever fainted or lost consciousness in
No.
any circumstance? No. Okay. No diabetes?
No.
No anemia, less iron or less blood in the body?
No.
Are you okay with healing when you get cut or grazed? Do you scar easily, or do you have any problems with?
Well, that's one I did recently when I burnt myself on an
okay.
oven. But yeah, normally it heals all okay.
Okay, that's fine. And you're okay at the sight of blood and needles and things? You don't?
Yeah, it doesn't worry me too much.
Sick. Okay. No operations before?
No.
No. Okay.
So I'm now in the treatment room, and I've just taken off my shirt, my watch, and I've just loosened my trousers slightly, but I can keep my trousers on apparently, which I guess protects the modesty a little bit. And then I'm going to just go and lie on top of the bed, and we'll find out exactly what I'm going to be having done.
So you feel comfy as you are?
Yeah.
Okay, excellent. So we're going to start with the cupping treatment now. I'm going to start off by just putting a little bit of oil onto the surface of the skin. I'm going to be using olive oil. Are you okay with olive oil? You don't have any allergies or anything to it?
No, that's fine.
Okay, perfect. Okay, so I'm just applying some of this oil now onto the surface of the skin and just rubbing it in and giving you a little bit of a massage.
So how long does this procedure take?
Well, Cupping itself, generally, you can't leave the cups on for too long,
Okay.
because if you leave the cups on for too long, they can actually blister the skin.
Oh.
So if you don't really know what you're doing, you can actually cause some severe kind of skin burns. Effectively, they're like pressure sores, but they happen the opposite way around. So generally, we allow around 20 minutes max for a treatment. You shouldn't really need it longer than that. One of the assessments we did earlier was just having a feel into the different areas of your muscles and of the tissues to find some of the tender spots and the areas which need a little bit more work. And I'm going to use a technique now in a minute which helps us kind of identify those a little bit further, to help us really pinpoint where the cups are going to be most effective. This technique that I'm using right now is actually something which has long been used in association with cupping. So cupping has never actually been a standalone treatment. It's always been integrated with other things. It's always been part of a system. In kind of Western culture, we have this concept of kind of reductionism, where we like to break everything down into the kind of smallest and kind of isolated things, and we say this is what's causing or this is what's benefiting me. But actually, when things are used in conjunction with each other, the kind of the whole is more than the sum of the parts, effectively. So this technique, in Chinese, they call this gua sha. It's a technique which they have often used with cupping, and even in South America, where they've used cupping as well, this was something that was used in the same way. They would use this same technique. Okay, so in my hand, you can't see this because obviously you're lying down, but in my hand I've got these mechanical vacuum cups, and I've got a handheld pump. So I'm just going to apply the first cup just up onto your shoulder here, and I'm just gradually applying a very light bit of suction. How does that feel?
Yeah, that feels fine.
Yeah. Does that feel too strong?
No, it feels all right.
Perfect. Okay. So right now, what we can see is the cup is applied, and the suction has drawn your skin up a little bit. So there's a little bit of a doming of the skin, which looks a little bit weird if you haven't seen it before. And what I'm going to do now is do a little bit of what we call cup massage. So I'm just gently and slowly gliding the cups over the skin, especially in these kind of tender areas which I've picked up earlier with my assessment.
Yeah.
So there you go, that's part one. The assessment and having the cups placed on my back. And as I say, there is a picture on Twitter. It's a rather full-on picture. It's my back with the suction cups on it, and you can see everything that's going on there. Not for the faint-hearted. We took Sophie, my producer, down with me, who was able to do the recording while I was lying there, face down on the couch. And at one point we had to say, "You're right, Sophie," just to make sure she wasn't passing out. Let's talk more about cupping now, because joining me in the studio is the gentleman who was carrying out that cupping. We're going to hear more of that in a moment's time, but he's in the studio with me live, and Dr Rizwhan Suleman, welcome, and thank you very much indeed for coming in. Thank you very much indeed for the cupping experience this morning. Now, before we talk about a little bit about what I had done and all the rest of it, and we've heard some of it there, what's your kind of definition of cupping? If somebody said to you, "Come on in, what's it about? What do you do for a living?" How would you make it really, really straightforward and explain it to someone?
Hi John, thanks for having me on the show,
Right.
and thanks for giving the cupping experience a go this morning. It was very brave of you, I would say.
I must admit, we sat there yesterday going, should he do it? Should I not? And then I just thought, well, I've had various forms of complementary therapy before. I've had osteopathy, I've had chiropractic work, I've had a little bit of acupuncture. So I thought, well, go on then, why not? Give it a whirl.
Excellent. Yeah, so my definition of cupping is really simple. It's just negative pressure applied on the surface of the skin.
What do you mean by negative pressure?
Negative pressure, so suction.
Right.
Okay, so positive pressure would be if something is putting force on something.
If you're pushing, like a massage.
Exactly, yeah. And negative pressure is the opposite, if you're actually pulling it up. So negative pressure or suction. And technically, even a hickey would be a form of cupping therapy. So yeah, effectively that's what it is. So the application of negative pressure on the surface of the skin is cupping therapy, and there's lots of different forms of that, and you can apply it in different ways. And as we gave you a bit of an experience today, you actually tried 3 different types of cupping therapy today. We did a little bit of
massage cupping with you, where we were gliding that suction across the skin, so the cups were moving on the surface of the skin. We did some static cupping, or dry cupping as it's known as, where we applied the cups and we just left them in one place. And we also did the more extreme version, as you might say, of wet cupping, where you actually make these tiny little pricks on the surface of the skin, or tiny little scratches on the surface of the skin, and you actually bleed the area. So you not only apply suction, but you also encourage an area to bleed and remove fluid from the body.
It seems, it seems on the face of it relatively harmless. I mean, obviously, anything that involves taking, removing blood, you do start to question things like regulation, who's doing it, where's the best place to go should you wish to have this. How stringently is cupping regulated? I mean, can there be harmful effects if in the wrong hands?
Well, yeah. First of all, I think anything really in the wrong hands, even a spoon in the wrong hands, could be harmful. Yes, as you rightly said, this involves, in some cases, when you're doing some forms of cupping, it involves breaking the surface of the skin. It does involve blood, and it does involve these sorts of things. However, because it's relatively new in the UK, in terms of the kind of usage of it, it's kind of a rebirth of it. We can go into kind of the history of it a little bit later, maybe, but it's relatively new. So the formation of a structured regulatory system isn't there in terms of legal regulation. However, I myself and a team of others about 7 years back now, set up a regulatory structure for it under the General Council of Complementary Therapies. So all complementary therapies are regulated to some degree, but these are regulated with what we call voluntary self-regulation. So if you go,
is that the same regulation that you'd have for an osteopath or a chiropractor or something like that?
No. So myself, I'm a chiropractor. So even when I practice cupping, I'm regulated as a chiropractor. So I am actually a regulated cupping practitioner, effectively. However, there can be other people who are not registered health professionals, doctors, chiropractors, osteopaths, or so forth, who are also practicing cupping. But we have an organization called ICAHT, which is the Institute of Clinically Applied Hijama Therapy, which is just another name for cupping. And what we do is we regulate practitioners. So we keep a register of practitioners in which we know, and we've assessed their level of competence. They've gone through a certain standard of education and level of training, and we also regulate them as well. So if there is anything that they have done or they do which is not in line with the code of conduct and in line with professional standards, then they're also accountable. But usually people who sign up to this type of voluntary self-regulation are more than willing to kind of abide by it, and that's the reason why they're signing up.
We'll talk more about it in a moment's time. Does it work? Does it not? How do you end up getting into it? That kind of thing. But let's have a listen to part two. This is the second bit of the cupping experience that I was having down at your clinic this morning. Let's have a listen to this.
So, obviously this is, you run a private practice, but in terms of acceptance of cupping, is it available on the NHS? Is it available by private healthcare companies? Do they offer it? Is it sort of becoming more common or more understood?
I think in general, complementary therapies are becoming a lot more accepted and a lot more utilised, and the literature and kind of research shows that that's true. In terms of the NHS, they do use complementary therapies for various things, especially kind of palliative care and these sorts of things. But as a kind of standard treatment, no, it's not available on the NHS, as far as I understand. In terms of private institutions which offer it, you'll find that there's a growing number of kind of private clinics and private places which will offer the treatment. And there's also private health insurers which often cover complementary therapies now as well. Taking this to that next kind of level of treatment, as I said, we're going to do a couple of cups of wet cupping therapy, so you can kind of experience that as well. So we're just going to do a couple of those. So I'm going to take some of these cups off and make tiny little nips into the surface of the skin, which are actually going to release out some of the blood from underneath the cups. What we'll do is we'll take the cup off, we'll apply the first tiny little nick on the surface of the skin, see how you feel. If you're comfortable with that, we'll continue. If you're not, then we'll just leave it and that'll be it.
And what is it drawing out by cutting the skin? toxins, is it?
Yeah, in traditional, kind of generally, the layperson will say that we're removing toxins. What we understand that we're doing from the clinical perspective or from the scientific perspective is we're creating a negative pressure in the tissues. So when you have an area, for example, when we assessed you, we found that there was areas of muscle tension and tightness. These scientifically often referred to as myofascial trigger points. And there's a lot of different theories as to what myofascial trigger points are and how they develop and what they actually constitute. But one of the things that we do know is that they're focal contractions in the muscle. So they're involuntary contractions, so where the muscle is tensing up by itself in a small knot or a small kind of portion or a small place in the muscle. When you have continuous muscle contraction, so if you were to try and, for example, clench your fist for a long period of time, what you start to feel is you'll start to feel you're fatiguing. You'll start to, even eventually, you'll feel pain in that hand. And that's because the muscle is tensing and it's using up a lot of energy when it's doing that. And it's leaving, it's creating quite often lactic acid because the oxygen supply to the tissues is reduced. And again, it then produces carbolic acid because the carbon dioxide it's producing stays within the tissues, and that itself can be an irritant to the muscle in the surrounding areas, which perpetuates this concept of a myofascial trigger point. So just by making these tiny nicks into the surface of the skin and allowing this the tissues, the fluid that the tissues are in to release, what we're doing is we're flushing that, and we're giving the muscle and the tissue a fresh supply of oxygenated blood and a fresh supply of nutrients, and hopefully resetting it from this phase of kind of continuous contraction. How's that?
Yeah, it's like being poked with a biro or something like that.
Yeah. Yeah, that's often what people describe. They say it feels like someone drawing on them with a pen. Okay. And where I've done that, there's no blood or anything coming out. Because literally I've just touched the blade on the surface of the skin just to create the tiniest little nick. Now I'm reapplying the cup, and as I do that, we're seeing just very tiny little dots of blood starting to seep out of these little scratches that we've made.
Okay. It's really strange because it feels like the cups are coming loose, but actually it just feels like also something, I can feel like almost like blood draining out of them as well. Is that normal?
Yeah, well, the cups are not coming loose. Often when there's a bit of a release in the tissue, that tension that you feel in the muscle starts to subside. And what you can feel is actually, yes, tiny little drops of blood, which are now seeping from these little cuts, and they're just dripping down into the cup.
So I've just got up off the bench, what do you call it? Treatment couch. And I do feel... Yeah, I feel a little bit lightheaded, a little bit tender, but not sore. And now it's just sort of, I don't know, it's that kind of, I don't know what to expect. I don't know whether, you know what I mean? It's sort of, yeah, it's very, I'm just looking at the pictures of it as well. And it's fascinating, it really is. I feel very relaxed. I feel very relaxed, very calm, very relaxed, and just... glad I did it, to be fair.
Perfect. Okay, just a little bit of oil on the neck.
Oh, okay.
Just clean that up there. Okay, yeah, perfect. So what I say to people is that, you don't necessarily expect instantaneous kind of results and changes.
Yeah, because that's you sort of sitting there thinking, how will I feel now? How will I feel now?
People expect different things, and people experience different things. Some people get up off the couch and they feel like, wow, they feel energetic, they want to get up and go, and they feel really enthusiastic, and it really changes kind of the way they feel.
I do feel enthusiastic. I suppose because your head's like in a hole, isn't it, for that session. I feel a little bit sort of...
How do you feel in the neck and shoulders? How do you feel in the body?
Good, looser.
Yeah. A lot of people say that they feel very light after the treatment, like something's been actually taken off or
removed.
It
does feel a bit lighter, but just, it's... Yeah, it's good.
Excellent. So it's normal for you to feel a little bit itchy around the areas where we've done the wet cupping.
I can feel that.
The sites where we've done the dry cupping, just like if you've had a bit of a massage, you can feel a little bit sore after.
Okay.
As I said, we haven't worked too firmly into the tissues. As I said, I wanted to make sure that we're going to your tolerance and we're not doing anything over the mark that we should be. So I don't expect you to feel too uncomfortable or anything kind of abnormal. You can carry on your day as usual.
And here I am carrying on my day as usual. Now it's do you know? I feel more upright. I'm trying to think. Do I feel more chilled or whatever? Dr Rizwhan Suleman, who performed that cupping, is in the studio with me again, and the big lumps that I've got on my back, which people are going to see in the pictures. How long do they take to sort of go away?
Okay, so literally that will go away within a day.
Right.
It does depend on how much kind of build-up there is in your body as well. Sometimes you'll have it, and usually when I have it, I don't really feel too much. I don't feel the lumps as soon as the suction's taken off. I don't really feel it stay there. Some people, they've got a little bit more build-up in their body. A lot more accumulates under the tissues and stays under the cup.
Right.
And then if you're just having dry cupping, that just stays in that one area. And then the concept is that the body then will disperse that and kind of get rid of that in its own natural way.
Plenty of water and all that kind of thing, just
exactly,
to flush the system through.
Exactly, yeah. But if you have wet cupping, then quite often that gets released. So there's not so much of it that remains under the site.
Let's take some news headlines, and then we're going to have a bit of traffic and travel, and then I just want to have a quick chat with you about just some of the things that people say about its authenticity. Does it actually work, and all that kind of thing. Is that all right?
Yeah, sure.
Still to come on the programme, we'll be speaking to Jane McDonald, of course, the singer. Yeah, she'll be joining me on the programme. And if that's not good enough for you, after 11 o'clock, UB40 will be joining me on this very programme as well. Lots to come here on BBC Radio Leicester. Now, we heard earlier on about this cupping therapy. Dr Rizwhan Suleman still in the studio with me. I just want to come up on a couple of points. Even, just this morning, some of the reaction to me having had it done, people saying, there's no evidence that it works. It could be dangerous. I've been sent a picture of a man who's got terrible black circular scars on his back where he looks like he's been burnt. How authentic is it? A lot of people are still very sceptical about it. What do you say when you're faced with that?
Well, it depends on how you look at it and what you what you kind of regard as authentic. If you want to look at it from a historical perspective, I would say it's pretty authentic because it's actually one of the oldest medicines known to mankind, effectively. The ancient Egyptians practiced this. One thing which I think is quite amazing about it is how it's so universal. Cupping therapy is found all over the world. In Poland, they call it bunki. In Kenya, they call it janja. In Somalia, they call it tobin. In Malaysia, they call it bekam. Everywhere you go in the world, you'll find it. And funny enough, I went to an isolated place in Kenya, and I went to kind of a village healer, and literally in the jungle. And he had these horns, and he was doing cupping. Now, people have different explanations for it. He thought that he was kind of expelling spirits and all this kind of stuff. So he had a different use of it. But the fact that globally, even here in the UK, it was used less than 100 years ago. It was a very common practice. So the benefits of this have been known. So in that sense, the authenticity is there, and it's just as as kind of simple to understand as the use of massage, of herbs, of medicines, of anything in that context. However, if you look at it in the context of what is known in the era of kind of evidence-based medicine or scientific kind of evidence, it will have its critics because there's not a lot of research on it. But unfortunately, there's a general tone when it comes to medical research, is that medical research will only be conducted on things which are funded to be researched. So you'd find that the people who would be interested in funding research are usually pharmaceutical companies. So medicine in general kind of sometimes can kind of automatically kind of or evolutionary, I guess, drift into only looking at drugs. So if you're only looking in
one area, you're not going to see the full picture. If you're only looking at one piece of the puzzle, you'll never see the big picture. So on that side of things, it does depend. But if you want to look at just simple evidence, I had a discussion with Professor David from
David Colquhoun.
From UCL, sorry. And he was saying that there's no such research and everything. But I find it quite funny, the fact that kind of people have just come across this and they're like, well, there's no research on it. Well, as a researcher, I would encourage him to maybe do a little bit of research on it, and maybe find some funding to do it, because he's probably funded by kind of pharmaceutical industry, so he probably wouldn't have the budget to look into that.
I've had it done. If you look on the BBC website, there's various people there having it done to see whether or not it works, and I'm grateful for doing it. I do feel slightly more straighter backed as a result of it. I do feel a little sleepy, like I could do with a nice lie down. I'll say that. And of course, the effects of it, as you say, they take a little while to bed in, see what it feels like, see what difference it makes.
But you've said it yourself, really, that you are experiencing something.
Yeah.
Would you say you're experiencing something, or
yes, absolutely. No, I don't feel like there's no difference whatsoever. No,
yeah. So the fact that you're experiencing something means that there is something happening.
Yeah,
it's not kind of hocus pocus, as it might be described. But in that context as well, if you think about it in the spectrum of health,
yes,
we've got people who are at the peak of health kind of utilization. Olympic athletes. If anyone knows about health and how to utilize their body, it would be someone like Michael Phelps, who has 19 gold medals. Now, who would you really want to take advice from? Michael Phelps, who knows about health, knows how to maximize his body and do things which are literally kind of people describe him as unhuman, in the way that he performs? Or would you take advice from someone who maybe sits behind a computer smoking a pipe, looking at statistics and thinking that they can figure out how health works on a computer?
Rizwhan, give us your website and your details as well for people to read up more, because I know you've got more on your website. So
yes,
give us the details of your clinic.
Yeah, so what I would say is that the website for registered cupping practitioners or hijama practitioners is ICAHT.co.uk. Which is spelled ICAHT. .co.uk.
So
ICAHT.
Yeah.
.co.uk. And that will put you through to a register of practitioners kind of internationally. We've trained people from all over the world.
Okay.
So my job, I'm a trained chiropractor, so I'm a doctor of chiropractic medicine. And my job is primarily to train people. That's what I do pretty much most of the time. And we also run a clinical practice, which is on Rolleston Street, which is the centre of integrative medicine, where we literally kind of use all different types of therapies, from speech therapies to acupuncture to hydrotherapy to various things to help people's health improve. So that's based on 83 Rolleston Street. And you can just Google Hijama or cupping in Leicester, and I'm sure you'll find us that way.
Well, listen, it's a joy to talk to you. Thank you very much indeed. I know you've been a very busy man. You were on Victoria Derbyshire's show yesterday, and here you are in the studio with us today, having met me at the crack of dawn. Well, not quite the crack of dawn. It was 8 o'clock this morning. It was crack of dawn when I got up to be there at 8 o'clock. But listen, thank you very much, and I look forward to seeing the effects of this cupping as well.
Thank you very much.
Thank you. Cheers. Thanks very much for coming in, Dr Rizwhan Suleman there. Still to come on the programme, Jane McDonald, UB40, and guinea pigs, but not as you may think.